you very much for having me here, and I hope we can move this debate on in a very useful way. So I'm a GP in South East London. I'm sort of work in the mud and mire of PCT land as well, and I'm patient and public involvement lead for the NHS Alliance, which spans really most of the primary care land in the NHS. And what I want to do is really to describe a project which we think offers a model of what big society could be. Now, the conversations I have listened to and been part of around big society are very diffuse, very high level, very aspirational, and we think that it actually might look a bit like, it could look a bit like this. And maybe I'd also like to draw a difference between patient and public involvement, which is kind of what you were talking about, and the big society, which actually I think has a far bigger agenda than that. It is potentially a much deeper idea about a relationship between services and communities. So anyway, what I want to talk about is a little bit about the theory about people and their own feelings of control and how things happen in local areas, this idea of what it could actually look like, and some links to do with the policy. And just to say, we have been pretty concerned about the big society. We think that there are real anxieties about whether this is just a cover for cuts, but on the whole I feel that this is a very interesting idea, and we think on the whole that this is more of an opportunity than a threat. So that's the sort of stance from which I come to this. There is a wealth of theory about how people relate to one another and how that and what effect and impact that has on health. I just want to quickly run through this. So this is, Ruth knows a million times more about this than I do, and I'm not an expert, but this is what I've distilled. There is huge evidence that social networks, by which I mean people you know, it's a very simple concept, protect physical and mental health by increasing resilience. So if you have people around you, you are more likely to stay healthy if you receive knocks. That social networks, if you improve and develop and deepen social networks, you get all sorts of other things that spin off apart from feeling healthier, being healthier. Community development, which is a broad sort of idea, which probably most of you have heard of, most community development is really pretty good at building social networks. And one of the outputs of having deeper and better social networks is that you feel more in charge of your life. You feel more confident, and you feel more able to take charge of what you do personally and what happens around you. And this is an important key to how things could be different in the future. So in a word, community development builds stronger and deeper social networks, which improves people's health, but also makes them feel that they're more in control of what they do and what they feel. So the Department of Health has been interested in this idea of community development amazingly for the last year or two, and they funded a group of us to develop a business case for community development. So they think all the sort of theory that I've produced, that's kind of bread and butter to them now, but they want to be able to show to GP commissioners that this is worth investing in. Well, they want to know whether it's worth investing in, because actually there's very little detail about this. NICE did a survey and came up with the conclusion that actually there was no economic data on community development, effectively. So we have been involved now in working in 3 estates in 3 areas in different parts of England, and we have put in a community development intervention, which has a particular approach and which has a 15-year history across different parts of England. And the idea is that it brings together local agencies with residents. So this is a joint cooperative enterprise. It builds social networks, it brings people together, and it makes agencies listen to what local people are saying. And this is the sort of study that we've been doing. So there are 2 estates. On one estate we put in a community development intervention, and that runs, it's been running for nearly a year now, and we monitor the outputs, and there's a control estate also on this area which we're also monitoring, and we hope to get some data. And at the moment we are getting some data which is really very positive and interesting. There are various difficulties about doing this. If you have this model, you have no idea what's going to come out. So the idea is that you listen to what the local community wants. That's the starting point. And mostly there are sort of common themes that come out, but you don't know what's going to come out. So it's very difficult to predict in advance what the economic model and what the economic consequences are. But nonetheless, we've been able to do it, and on the whole, more or less, we think we have a clear story. And looking at the places where we're doing this work, but also looking at the history of this kind of work, there are some substantial outcomes which fit very much with the evidence generally across the Third World and in the US as well. So these are the kind of things, can everybody see the screen? These are the kind of things that happen after about 2 to 3 to 5 years. And what generally happens is that communities start about the issues that matter to them, which are really usually about crime, housing, education. And by bringing them together with agencies very rapidly, we've seen in these 3 sites that we're doing within about 6 months, agencies start dealing with residents in a completely different way. And things start beginning to change in a very radical way. Local leaders turn up, people rise up from the community and start taking charge. And there are very rapid changes, and people begin to feel much more confident. And eventually, these health benefits accrue. And we think there's a reasonable saving that comes out of this. And that 70k per 5,000 population, we think, is roughly the kind of saving on health, which does not include things like saving on antisocial behaviour and so on. These are the kind of things that the local people are beginning to start. And one of the early things that happens is that people start forming themselves into a more formal organisation, because then they can start demanding things in a much more positive way from local services. And these kind of changes have happened within about 6 months. And you can see, I think, that this is one model, this is one approach that links to the white paper, but also, of course, Big Society. And what Big Society has at least 2 strands, it seems to me. One is that Nat Way and the ministers are really talking about volunteering quite a lot of the time. So they're talking about people doing some of this work themselves, and that is, so they'd be picking up the rubbish, they would be, I don't know what they'd be doing in health, they'd be seeing the patients, I'm not quite sure, prescribing, I'm not quite sure really how that would work, but so there is a strand about volunteering, people doing the job themselves, but there is also a strand about responsive agencies, and it's that bit that we see happening very quickly. So agencies which are normally seen as very distant, they have an agenda, they keep going, regardless of what people are saying. And in these communities, people have felt totally left behind. We are going into estates that the PCT has identified and the local authority has identified as being really in a quite desperate place. And so we see changes happening very, very rapidly, and it is mainly around agencies being much more flexible. This has now been done in 7 estates over 10 years. We think the skills are transferable. We know that they're sustainable because they have been going for 10 years in a couple of places now. And we think this is, we can train people to do this. It is rocket science, actually. It's quite a skilled piece of work. You can't go in and do this just off the cuff. So the more we learn about how this happens, it is actually very skilled work. But the changes are dramatic, and they happen relatively quickly. So we see this as a really exciting opportunity, and we think big society should listen to this as one option. I think that's all.